Hi, this is Gary Kellstrom, and it's March 25th, 2020. We're going to look at a strategy to win against novel COVID-19. All right, this is it, the strategy to win against novel COVID-19. So I divided this up into 5 sections, but we'll start with the people. Smart wins. Stay isolated, wash your hands, practice decontamination, and stay healthy. Strong isn't enough. Great civilizations have been defeated by biological threats. To win, everyone needs to act smart. Don't be a grenade. All right, next we want to define the threat, and then we'll look at how to mitigate the threat. These are listed in pairs. So first, we know we have airborne threats, aerosol, droplets. Personal protection equipment will help protect against that. Next, we have the environment, inside and outside. Inside needs to be cleaned. Outside, we need to spray our outdoors. We need to take a look and observe what other countries have done. See it on the news all the time. They're spraying, and I remember seeing it the first time I saw it, so I thought, well, that's kind of ridiculous that they're spraying the streets. But now we know this virus survives 3 to 9 days on surfaces, and if we're going to defeat this, we need to take the contaminant out of the environment so that we don't track it into our homes and onto our hands as we remove our shoes or our clothes. So it's important. I think it's something that we're not seeing a lot of, and I'm not sure that where we are doing it, if we're doing it correctly. A little more on that later. So the next one is our health. And if you look at our health system and our mitigation plan, I think we've got the best healthcare system in the world, and we're in pretty good shape there as long as we don't overload our capacity. And I think we're so far, I think we've taken all the right steps to do just that, to ensure that our capacity to help one another is sufficient. Our economy, as of tonight, the relief bill was passed in the Senate, so I think that we're doing the right things in that realm as well. And then we have national security. I do want to talk about national security a little bit. Supply planning plays into national security, as well as our military. Just like our healthcare workers need the personal protection, the masks. Specifically, I'm thinking of masks, gloves. So does our military. They're just as essential, whether they're there to aid or to protect. We need to protect our armed services. I just want to go back to the decontaminating public areas. There's an article here from sciencemag.org entitled, "Does Disinfecting Surfaces Really Prevent the Spread of Coronavirus?" And it goes on to talk about how China and other areas have utilized spraying and fogging to disinfect. Part of the article goes on to say that roads and lawns and public areas shouldn't be sprayed repeatedly. I think the key word there is repeatedly. That they should be disinfected repeatedly is not necessary, but at least a one-time spray. And this is an area that I think needs to be studied, and then a protocol developed federally so that every area, certainly each state can do their own work, but we need to follow some guidelines that we know work, because I see a lot of surfaces being wiped down with rags. I don't know if that's really sufficiently disinfecting or decontaminating, if it's deactivating this virus. We know that it lives in small places, which is why I'm led to believe that fogging and spraying is more effective than wiping. So I think a little more studying needs to be done there. and we can make some improvements in that area before we release ourselves back out into the wild, so to speak, where the contaminants may reinfect the population. The last thing I'd like to emphasize is personal protection equipment for everyone. Specifically, I'm talking about masks, perhaps gloves. There's going to be situations after we're done with our self-isolation. It could be carpooling, could be riding in an elevator, riding in a subway, or even just grocery shopping, where it could be a high concentration of people and you're just not going to feel comfortable being unprotected. So when we're released from our self-isolation period, our supply chains should be sufficiently replenished to make available anybody masks for anybody that wants to wear them. I think that'll be critical to our successful elimination of this virus in the environment. Next, let's take a look at a couple of other countries and see how long it's taken them to heal. This chart shows active cases in light blue, total recovered cases in green, and total deaths in red. Let's take a look at China first. It's taken them 2 months since their 500th case to convert their active cases to outcomes. They're currently at 94%. If we look at Italy, their 500th case was 1 month ago. They're only at 21% outcomes, a majority, obviously, of active cases. And for us here in the U.S., we're only at 1.9% outcomes. We're just at the very beginning of this process. Worth noting is the death rate and the recoveries, 295 recoveries, 582 deaths. And that's as of March 24th. And as improvements in medical treatment become available, the rate of recovery should accelerate. Finally, the U.S. death rate is 1.3%, which is very low for this novel COVID-19. As long as our patients needing hospitalization and intensive care continue to get that kind of care, we can ensure that death rate remains the same, which is why we can anticipate an increase in recovery rates. All right, thank you and stay healthy.